described an inhaler. What are inhalers? Inhalers are canisters that contain aerosolized medications for your lungs. When activated, the medications are delivered to your lungs as you inhale. How do inhalers work? Airway constriction and inflammation are found with diseases like asthma, COPD, emphysema, and lung infections. In these diseases, muscles around your airways constrict abnormally and narrow the airways. Some types of inhalers send medications to these muscles, causing them to relax. This opens your airways and helps you breathe easier. These diseases also cause inflammation in the lining of the airways. The thick inflammation blocks the airways. Steroid inhalers are used to reduce and remove the inflammation. This also opens the airways, making it easier to breathe. How are inhalers used? Inhalers require you to breathe in as the medicine comes out of the canister. It's a little difficult to coordinate this, so sometimes a chamber is attached to the canister. You can spray the medication into the canister and then breathe in the medication. Inhalers that relax the airway muscles usually do not last very long, only 3 to 4 hours, so the inhaler should be carried with you throughout the day. Use it regularly. Also use it if you have a sudden worsening of symptoms. Generally, you take 2 puffs each use. Steroid inhalers are typically used once or twice a day. They can usually be left at home and used just morning and night. They are usually dosed at 2 to 4 puffs for each use. Alternatives to inhalers. Many inhaled medications can be taken as pills. Taking the medicines as pills subjects your entire body to the effects of the medications. This can cause uncomfortable or even dangerous side effects. The advantage of the inhalers is the medication goes only to the affected areas in your lungs. For this reason, the inhaled approach is usually preferred. Dangers and side effects. The muscle-relaxing medications can cause a slight increase in your heart rate and blood pressure. This happens when you need multiple doses for an episode of difficult breathing. This effect is less dangerous than not getting enough oxygen because you didn't use the inhaler. Steroid pills taken by mouth for a long time can have serious side effects. Inhaled steroids do not appear to cause those side effects, but they can cause a yeast infection in your mouth. This can be avoided by rinsing your mouth after each use. When to seek further care. Most people do well with inhalers and do not have any side effects or complications. The biggest danger is usually running out of the inhaler when you still need it. It is a good idea to keep a backup inhaler on hand. If you use your inhalers and still have difficulty breathing or chest pain, then immediately call your doctor, nurse, or caregiver. If they are unavailable, call 911.